You know there's a way for nurses to start a business, but there's so many moving pieces. Cut through the crap. It's time to go right to the source and get real about what's working in business and marketing for nurses with your host, the founder of Nursepreneurs, Catie Harris.
Hi, it's Catie Harris, and this is an episode of the Nursepreneurs podcast. Today I have Dr. Jeff One with us from Recellebrate, all the way from Las Vegas. So welcome to the show, Jeff.
Thank you so much for having me. Nice to meet you.
Absolutely. So tell us a little bit about you so we have a background, who you are, and then we'll talk about how you got into what you're doing now.
Well, background-wise, I am a recovering neurosurgeon. We were talking about that a little bit off the recording, but I was a spine fellowship neurosurgeon. I still am. I do a little bit of that, but I'm happy to have sort of opened my eyes to newer things in biomedicine, things that are less invasive, less risky, things that don't require the purview of economic forces that obstruct the ability of people like you and me to deliver quality healthcare. You know, I'm speaking to health insurance and, cookbook-driven sick care systems that just don't modernize and move forward. So out of frustration, I've moved into I went to add regenerative medicine to my practice, and now that's almost all I do, sort of by accident.
So did you find that your colleagues had issues with what you were doing, or are they kind of like curious? Because I haven't gotten in my own realm a great response from the neurosurgeons in my area with what I do.
There's half and half. So the Kool-Aid is very strong, right? You're trained, to practice by people who were trained to practice decades and decades earlier, and nothing really changes. In spine surgery, for example, what we do for the spine, and you know this because you worked in this field, is really two things. We either make more room for nerves or we use it together, we stabilize it. Sometimes both. But those are your two menu items. That has not changed since the 1940s.
Mm-hmm.
It hasn't. Yeah, there's a new screw, a new approach, a new bell and whistle. Maybe you do a little smaller incision, whatever. It's the same two things. And a lot of people just, when they're trained that way, the blinders get slapped on, and then it gets worse. They start only treating what gets approved.
Mm-hmm.
Well, I'd love to do this, this, and this, but they're not going to approve it. So we're going to do this other thing. Well, it's horrible. Why go through all those years of med school if you're just following the United Healthcare cookbook, So, and I didn't mean to sing United. There's Cigna.
Right, that's all of them.
all the other people who obstruct good healthcare, deny, delay, obstruct good healthcare. So the ability to carry out our Hippocratic oath, has to come from somewhere. So I've always kind of, bucked against that. But half my colleagues were, hey, tell me more about what you're doing. And they call me up and tell me more. Maybe I'll look into that, but it's really hard to, come out of their lane. It's like the self-driving cars, and they only see the lane. They cannot change lanes. And yeah. So probably half and half.
Okay. And from that perspective as well, how did you discover this for yourself? Like, how did you know that you wanted to go into regenerative medicine?
So it's not really my doing. It's my patients who became smarter and smarter and came to me and said, hey, I've got this neck problem, this back problem. I've tried everything you've recommended for me. We've tried the therapies, we've tried the medications, we've tried the injections. Yeah, they help for a little bit. They help temporarily. They help partially. I'm still having problems. I can't do what I used to do. What do you got left? Oh, well, the only thing I have left is to talk about surgical options. Oh, no, I don't want surgery, they say, right? So I say, okay, great. Because really, I didn't want to offer you that because you're not bad enough. You have a problem, but you could still get a better day every day, go to work. And, maybe you can't play 18 holes of golf without taking the cart. But, there's that big gap between non-surgical and surgical things. And this is true in orthopedics too, not just neurosurgery spine, right? You've got some, joint cleanups, but the next big step is sort of like the joint replacement. That's a big, rather barbaric endeavor. So, and they can be very helpful. I don't mean to completely, destroy the reputation of these big surgeries. There's a role for them.
Yes.
But if they're overused, overdone, overburdened, and guess what? When you use it too much, the results aren't good across the board, right? You have a lot of people who just like that was the surgery has risk, right? It's a big endeavor. So patients would say, "What else you got? How about this? How about that? How about crystals? How about stem cells?" And
Hmm.
you hear stem cells enough time, and I love this phrase: "A chance favors the prepared mind." I forgot who said it. I'm sure one of your listeners will write in and remind me, but um, I have an undergraduate background in molecular biology, which is the field of regenerative stem cell medicine, right? Cellular biology. So I love that stuff in the day. But you go to undergraduate school, you love that stuff, and then I'm going to go to med school, and then residency, and then fellowship, and then practice. And by the time decades have passed, you look back and said, "Yeah, I love that stuff. I just haven't touched it in so many years." But I said, you know what? I'm going to look into this stuff. So instead of going to the annual neurosurgical meeting or a bunch of bow tie wearing, nerds, I'm a nerd too. But
They
they're,
are. They're nerds with power.
well, they self-impose power. So
Yeah.
let's be clear. Their power is really the insurance company's power. It's not their power. They're just
Yeah.
wielding someone else's power. So, but at least egos. So they like to give them power. Instead of going to those meetings where those guys pat themselves on the back for doing the same thing year after year and reporting it, and a new paper is presented, wins an award, they publish the same stuff 20 years earlier.
Yeah.
Nothing's changed. Like I just saw this online because I get all the emails. Like, really, that's the same thing that was published 20, 25 years ago. So, I said, screw it. I'm gonna, change course. I'm gonna take the road less traveled. If I can, get a little frosty here. And I started going to different things, started going to regenerative medicine meetings. They offer continuing medical education. I started retraining and reading, and now I've been doing this for over 7 years, and I'm writing textbook chapters and publishing journal articles, and and I wanted to do it as a tool for my patients, but it's opened up this whole new business, which is why I renamed my practice Recellebrate. So there you have it.
I love it. And it's a play on words too. So Cell, I love that.
Correct. Thank you for noticing.
Yeah. Okay, so your Recelebrate, tell us what you focus on in Recelebrate and the services that you offer in there.
Well, the main thing I still do is structural joints and spine. And I'm actually doing more joints than spine. And by joints, I mean non-spine joints, because you and I both know part of the spine is made up of joints. But the low-hanging fruit in regenerative medicine is really helping people combat the inflammatory degenerative damage of spine and joints, that's sometimes called osteoarthritis, or for short, some doctors call it arthritis, which is a little vague for my liking. Or they call it, and I hate this phrase, degenerative joint disease,
Hmm.
just like I hate the phrase degenerative disc disease, because let's be frank, it's not a disease.
Right.
A collection of inflammatory damages from injury, wear and tear, cumulative trauma, what have you. It's not a disease. You're not born with that. Rheumatoid arthritis is a disease. That's a genetic disease. So I do a lot of structural work, and it comes easy to me. I'm a surgeon, so we do injections. We do them at a surgery center under sterile, in a sterile room, because I'm a surgeon. We like the whole, clean aspect of it. Um, and then in the office, I'm now doing intravenous work. So we do, preventative, anti-inflammatory IVs. We're doing, for patients who are biohackers or longevity seekers. This is something that they might like. People recovering from an inflammatory problem like a heart attack, stroke. Alzheimer's has an inflammatory component, coronary vascular disease. Really, all of the diseases of aging have a chronic inflammatory component. Chronic inflammation here being the key word for aging, right? And some people use the phrase inflammaging, which is great,
Hmm.
because really the more accumulation of inflammation you have, the more aged your cells are, or at least biologically aged they are, and vice versa. So, and then we do a few little cosmetic things for fun, scalp injections, skin, micro injections of exosomes, and then sexual health for women and men. We have some injections there and a few other little miscellaneous things. And recently, we finally got a hold of something called natural killer cell exosomes, which were only available in Asia and Europe until recently. So we have imported those, and those are useful to help remove senescent, zombie cells, and they are found to have cancer killing properties. So we're trying to use those as an adjunct for cancer or to help support remission or prevention in people that are high risk.
Okay, so how do you know the stem cells that you're getting are going to be good? Like what is the process for that? And what is it for the general public? Like what kind of questions should they be asking to know they're getting the good stuff?
Well, first, let's break down regenerative biologics. So regenerative biologics can be stem cells. They can be PRP, which comes from your own blood, and they can be other non-cellular products like purified amniotic fluid, although it's already pure, tested to be pure amniotic fluid, which contains something called stem cell-derived exosomes or extracellular vesicles. When I started in this field, they were kind of new. Turns out stem cells do their work in our body by delivering this exosome message to our cells, and our cells do the real healing. So we're now skipping ahead of the stem cells, going right to the exosome. So it's a non-cellular product that travels better through the body. It's from amniotic fluid. Amniotic fluid is more abundant than umbilical cord cells or Wharton's jelly, which are the source of stem cells. So it's less costly. For about a third of the cost, you can have fresh frozen exosomes from stem cells as opposed to the stem cells themselves. They cross the blood-brain barrier if you give them IV. It's the reason why a pregnant woman has glowing skin and wonderful hair and nail growth and feels good and has good mood. They're getting exosomes through the placenta. They're not getting stem cells through the placenta, right? And remember, stem cells are chimeric. They're half the genes of the mother, half of the father, whereas the exosomes are neutral. Like they have no surface markings that show them as foreign, so they never get rejected. And I think they're all in all, we get at least the same results, if not in some cases easier to deliver than the stem cells. So how do you vet these? Well, there are a lot of labs now in the country you can buy them. So I have vetted many labs, and my favorite lab where I purchase these products from takes from a donor pool of people that have not had the COVID vaccine.
Mm-hmm.
So that wasn't meant to be political statement. It could be, but it wasn't meant to be. It was meant to say, because we just don't know enough, as we're now finding out, why take a chance? So we remove that variable. These are women who have not had the COVID vaccine. They're going to have a known C-section. They are first screened in their first trimester. They no smoking, drinking, or drugs. They can only have one sexual partner throughout their pregnancy, so no high-risk behaviors. They're screened again at the time of birth. The baby has to be healthy. These women take prenatal vitamins during that time, and then at the delivery, it goes on ice. The fluid goes on ice. The lab does a full screening panel. All the viruses are tested, endotoxin tested, quarantined for 2 weeks, and then they also do protein content, because amniotic fluid is more than exosomes. It's got all the good growth factors that make a human. Right, the endothelial growth factors and the platelet-derived growth factors and the brain-derived neurotrophic factors and the good tumor necrosis factors and all the good stuff we want in there. So it's like the best part of PRP plus the stem cell signal put together in a concentrated way without being manipulated, fresh frozen, comes to me on dry ice, goes into my -30 centigrade freezer. And that's what I'm using. Nothing's lyophilized or powdered, has to be reconstituted. This is like day zero, fresh from the womb. You couldn't get it any better.
Mm-hmm. Okay. And so can you explain that you've explained the difference between like exosomes and stem cells, but how would you choose what you're going to use for whom?
I'm using mostly exosomes these days.
So you've kind of switched over. Okay.
Yeah, I know we've done stem cells here and there. We have some people who have banked their own cells and they just call for them and we use them. Again, they don't travel throughout the body as well. The heart and lungs take them up preferentially in an intravenous delivery. and they don't cross the blood-brain barrier, but they do produce some exosomes that do cross. So they're not as ideal for most purposes. We have people with bronchitis and lung problems. We can do inhalational with the exosomes. They're so tiny. But we can't do that with stem cells successfully. We can do nasal spray with the exosomes to get them through the cribriform plate up into the brain is another delivery. With our autism crowd, that's what we're doing because those children just won't sit for an IV necessarily, most of them. So stem cells, you can't do that. Again,
Okay.
stem cells are about 3 times the price. Plus, they do have some markers on their cell surface. So theoretically, there's rejection. We've never seen it. I always tell people it could happen. I've never read about it or seen it, but exosomes, we just don't have that. Exosomes are if I gave you stem cells today, they'd be out of your system in 10 to 14 days, but the benefits would last longer. Why? Because they delivered the exosome. So we're just skipping the delivery van and going right to the Amazon delivery, right to your door.
Yeah, I love that. So how do you determine who's a good candidate? And are there people that you turn away for this type of therapy?
Okay. Well, first, we want people optimized. If you're going to spend the money on something like this, even though it's less expensive than the stem cells, and you want to get better and you want this to work, you got to do the work. So we want to pay attention to your diet, your supplements, your exercise, your sleep, your hormone optimization, which is now a big factor, we think, and different elements I'm probably failing to list here, so that someone's cells are as least inflamed as possible. So if you're eating fast food and seed oils and fried foods and lots of sugar, you're not going to do as well as someone who's already optimized. So we like people optimized. We help them get there. We don't just like it. So we do talk about it in a full anti-aging protocol if that's what you're interested in. Even for joint work, you've probably seen this before. You have people with aches and pains in their joints. They clean up their diet. They cut out sugar, maybe gluten. All of a sudden, their joints feel better, right?
Yeah.
Because you've reduced the inflammation in their body. So, and we make sure they've tried everything else, and then we do targeting. So let's say it's a joint problem. We want a high quality 3T MRI, and for those of you listening at home, 3T is the highest resolution in the community, even though they have a couple 7Ts in some academic centers. They're very few and far between. So 3T gives a better picture, and we get something called inversion recovery sequences, and you know what that means because you did neurosurgery, but it helps bring out inflammatory change in the bone marrow adjacent to cartilage loss, and those help us with targets. So if we have a clinically correlated confirmed pain generator with targeting, and they're all cleaned up, then and only then do we invite them to come to Las Vegas for a treatment. Most of the work we do is remote.
Okay. And so people come from all over the country and maybe even the world for you.
Yeah, we've had people from the UK, from Canada. I've talked to people in other countries, but I haven't had any visitors from further than that, although it's pretty far.
Yeah, it's pretty far.
Luckily, here in Las Vegas, you can almost get a direct flight from a lot of international places. Vegas is kind of a destination. So we love when people come out, spend a few days, take in a nice dinner and show and enjoy some of the fun that Vegas has as an entertainment town. And then we'll take care of your problem while you're here.
Okay, so for providers specifically, that are thinking about incorporating regenerative therapies, like what should they be considering? What type of education should they really be getting for themselves?
Well, if you're already in the sort of the prospective health and wellness space, maybe you're a member of the American Academy of Anti-Aging Medicine, A4M, or one of the other, integrative or other groups. It's a great place to start. Then there are courses available, different courses in regenerative medicine. And some of them are how-to courses, how to inject stuff. Some of them are ultrasound based. I'm not an ultrasound based guy because, as you know, I'm a neurosurgeon, and the only thing we really do with ultrasound is sometimes in surgery, we use it to help find like a cystic lesion in the spinal cord or brain. So we don't use it a lot. So it's not something I use in my clinic. If we do something, we do it at the surgery center under fluoroscopy guidance, which is, a type of X-ray. So I would say so those courses are a great place to start. They're online. You can look up stem cell or regenerative medicine course. You'll learn all about it. That's how I started. I went to a course, and from there it just my eyes opened and like, wow, this is not something just to add. This is an entire realm of medicine. And now I'm trying to work with medical schools to put in curriculum so that doctors aren't so close-minded coming out of, their residencies.
Yeah, that's the one thing I really kind of learned in the last couple of years delving into this is that there are so many like I used to be kind of anti-supplement, like, oh, it's just, expensive pee, basically.
Yeah.
And then I'm just kind of like, well, now I'm like, oh my God, like I can't believe I haven't been taking these all these
Yeah.
years.
Yeah, I for many years I didn't take much at all, but and there was a recent paper out we should mention. I think I saw it in the last few weeks that the health profiles of elder people taking supplements was better than those that were not. And I can't remember the exact details or what they measured, but I said that somewhat vaguely. Very recent paper. So
Right.
yeah, I am a very big on supplements now. And why do we do this? Because there's no way that our watered down processed diet, even to the extent we try to eat real foods, are adequate to give us the diversity of bionutrients. And now that we know that some of those bionutrients are anti-inflammatory and pro-longevity, you take a little extra. You take a little extra berberine or spermidine or quercetin or what whatever phytonutrients we're missing because we're not eating this diversity of fruits and vegetables. And if we do, it's probably genetically modified to be sort of watered down of sorts, so
Hmm.
they could have more fruit on the tree that lasts longer, ripen slower. So in any event, that's what supplements are for. So have your expensive pee. I do too, and you don't have to spend thousands of dollars on that, right? If you do it right, like I take melatonin every night. A bottle of 300 of those is less than $10.
Yeah.
So yeah, so don't yeah, do your homework. You can find a high quality supplement for not that much.
Yeah, absolutely. Absolutely. So what advice would you give to people that are looking for reputable regenerative medicine providers? Because there's a growing number of them, but it's hard to know who to go to, who's going to
Yeah.
give you good advice.
Well, listen, I got to be careful here. I mean, I'm always amazed that like there are all these chiropractors out there that are doing regenerative medicine now. So I like that they're pro health and they're cutting edge and open minded, but I don't know that they're trained to manage the complications and things of a medical treatment per se. So, there are a bunch of marketing schemes out there. Some of the regenerative companies have to sell their products, they go to chiropractors and they create this. I don't know if it's multi-level or whatever. So be careful. Be careful if the claims are there to sound too good to be true. I see people on social media all the day saying this cures that and this. Let's be super clear. The FDA has not yet approved regenerative biologics for marketing claims.
Hmm.
PRP, stem cells, exosomes, we are not allowed to say they cure or treat a disease or condition. Their words, not mine. But we
Right.
want to be compliant with that. I can show you examples. I can show you medical evidence and literature. I can talk about what they help your body do to heal and what they help do for cellular health. I can tell you that all day long. I make sure all my patients know that I'm not making any claims and what that means. Most people looking into this field already get it. Now, just because the FDA hasn't approved the marketing claims doesn't mean they haven't disapproved or unapproved them.
Hmm.
It means they haven't yet evaluated them. So it's sort of a neutral stance. And people think, oh, it's not approved, you can't do it, or it's illegal. Oh my God, get a life. It's not the truth. So who puts that out there? Competitors, big
Yeah.
pharma, others. So I think be careful, watch out for too many claims. And then, there are a lot of international stem cell clinics, and they can say whatever they want because they're
Right.
not beholden to United States laws. So they say, oh yeah, come down here, we'll cure this and that. Great. If you want to trip down to Costa Rica, Mexico, Panama, great, go down there. It's fine. I would say if you're looking at stem cells, be careful if they come from culture and they're divided cells that divide and divide. You don't want to have cells that have divided more than 2 or 3 times because then you get a copy of a copy of a copy and their telomere length changes. Then you have basically a senescent phenotype of that cell. And you don't want the zombie version, you want the fresh version. So that's why I use only fresh frozen material, nothing cultured or divided, and then ask your clinician what they're using. So for in the exosome world, if you're not getting a product that's 500 billion trillion in the count, then you're goofing around. If you're saying, oh, it's 50 billion, uh, you know, 50 billion's nothing.
Yeah.
I could sneeze more than 50 billion exosomes. So, but people charge a lot of money for that because it's exosomes and it's a hot topic now.
Right.
Also, be wary of some of the cosmetic, aesthetic uses. Exosomes are really tough to get through the skin. So they have to be injected. There are very few topical products that get stuff through, and the emollients have to be very low molecular weight, and it's very difficult. So a lot of the stuff you see advertised is just to get you in the door. So, and a lot of those products are lyophilized, which is code for freeze dried, like
Right.
Astronauts drink Tang, right? Powdered orange drink. Well, you lose a lot of the growth factors. You lose some of the exosomes when you heat them and dry them and turn it into a powder that has to be reconstituted. So those are not my favorite. Now, having said that, sometimes that's the only option. For example, right now, our natural killer cell exosomes can only come that way. We wouldn't be able to get them from Europe on dry ice in time. So they come that way. We do reconstitute them, but we know to make up for that loss when we dose it.
Is there ever going to be a time where they'll manufacture them in the US?
Yeah, it's coming.
Okay, it's coming.
It's coming.
Well,
It's
that's
coming.
exciting.
We're catching up slowly. And as there are more clinics and more people using this and more interest in this, and especially there's sort of this resurgence in health, wellness, and preventative care with sort of change in government. I hope and pray we're gonna see that an acceleration and a catch up with Europe, and let our American medical biotechnology and know-how accelerate and exceed what you see in other places.
Yeah.
The problem is big pharma is sticking its finger in it already, and they're going to slow it down and over monetize it. So get in now while you can.
Right. Yeah. And that's been a huge problem because you see all these things that are being done around the world, these therapies that just are more advanced and, I mean, they're out there and we can't get our hands on a lot of it. And I was just at a wellness panel here in Philadelphia, and they brought a stem cell expert up from Panama who was recruiting people to go down there. And I'm like, and somebody in the audience says, well, why do we have to go international? I'm like, you don't. You don't have to go international. Like, they're not illegal in the United States.
No, but people love to say that, though, don't they?
Yeah, I don't understand.
It's not approved. Well, so if it's a marketing claim, the FDA regulates marketing claims. So as long as you're not making a marketing claim. Now, if you did make an improper marketing claim, it's still not illegal. You're non-compliant. You get a letter. You got to behave. You got to do it right. So this isn't legal advice, but I've been doing this for a number of years. I've got legal advice. I've been through this. It's a wild world out there, and people say whatever to be a competitor. So there are haters. I get it online all the time. We post something on TikTok, and then you get this strange account saying, "No, you have to go to Panama." It's some troll down in Panama who gets a commission from diverting work down there, right? So, and nothing bad about the Panama guys. I've met some of them. They do decent work. It's not a problem. It's just it's not because you can't do it here. I agree.
Right. Yeah, no, I've in the last couple of months, I've run into people that were like looking into trips to Panama, and I'm like, I'm down the street, like, and I don't advertise stem cells or anything like that on my website because I mainly do hormone therapy, and when I get them in the door, we can have these discussions. Plus, like you, I want them optimized before I start injecting people with stem cells because to me, it's part of a program. It is not the end all be all of your condition. That's really important to me.
Perfect. Yeah, no, I agree with you completely. We also cannot advertise on Google ads and Facebook ads.
Oh, yeah. Okay.
You cannot advertise regenerative medicine, peptides, stem cells, exosomes, Anti-aging, you can't use those words in an ad. You can have a website that has that, but you cannot have those. They will not let you. There is a restriction of that. Um, and it's somewhat distasteful. That's still going on, despite
Yeah.
what's been found out recently about how these social media companies were, sort of, pulling the reins on certain information being let out and not let out in recent past.
Shocking.
Shocking, yeah, not shocking,
Not
but
here.
yeah, yeah, yeah.
Yeah, absolutely. So what is it that is there like some favorite stories that you have or patient stories?
Yeah, I mean, my one of my favorite ones is I have this sweet woman. She first came in, I think she was 79. She was retired. She's worked her entire life, raised her kids as a single mom, was really salt of the earth lady from upstate New York, but she happened to move here to Vegas to warm up. And she would paint these large river rocks and give them away as gifts, to the postman or whatever. And she brought me one. It's in my one of my clinic rooms. It's like a paperweight, but it's decorative. So I leave it there. I like it. And she came in, she's like, I can't paint these anymore. My hands are just like, they always say I have arthritis, even though they have, no true, antibody marker for that. Yeah. My doctor said I have arthritis. So yeah, you've got our osteoarthritis, and her knees were creaky and cracky. And I said, you know what, let's try an IV. You've got all these things throughout your body. Let's try an IV. So we do an IV. And it's low dose. It was our lowest dose is 2 cc of the amniotic fluid, which is about 520 billion exosomes. So, and she came back and was painting the rocks again and was walking, and she said, "I got to tell you, um, I've got return of sight in my partial light sight in my eye." I'm like, "What do you mean return of sight? What are you talking about?" She's like, "Well, I don't bother you with this because my entire life that I recall, I've been blind in this one eye. So maybe I told you, maybe I've put it on my forms. I don't know, but it's not something I deal with because I don't think I ever come back. I now have I can see light in that eye."
Oh, wow.
So I never expected that. I didn't know about it or wasn't paying attention to it. And I said, well, there must be some inflammatory reason that we help suppress that inflammation, because I mean, we didn't just regenerate your optic nerve or something. There's got to be a reason for this, some neuritis or retinitis or something. So I couldn't explain it, but she's like, well, it's cool. I'll just live with it. When do I come back? She says. I said, well, you let me know. You see how it goes. I didn't hear from her for 2 years. She called me up and we had a little phone visit. I said, how's it going? She's like, I had a great 2 years. I did everything, but over the last few weeks, I'm starting to get the aches and pains again. I said, are you ready? She's like, I could be ready. So she came back in. We did another dose. This was last year sometime. And lo and behold, helped again. All her aches and pains were quiet, doing great. And I haven't heard from her probably in almost a year. So
Wow.
she's probably one of my favorite stories. So she's very she tells a story in great detail. She's very fun to listen to, and I just love the results she got with a minimal dose.
Yeah. Yeah. No, I love that. I actually did I injected PRP in somebody's back, and like 6 months later he's like, I still feel great, and that's just PRP. It wasn't like anything exciting. But I'm like, this is kind of a bad business model in a way, like if you just fix people and then they don't come back.
Well, I mean, that's what we're supposed to do. So there are plenty of
Yep.
people to fix. Just fix one, and then when he's got something else, he'll call you. But
Yeah.
yeah, it's people will continue to self-destruct. They'll be back. But yeah, it's great. I mean, listen, if I had this tool my whole career, or you did, I mean, we would be like, wow, we would have done a lot less surgery and help people quicker and easier, help their body heal themselves like they did when they were younger.
I love it. All right, Dr. Jeff, if people want to learn more about what you're doing, where do they go? How do they find you? How do they connect with you?
They go to recellebrate.com, Recellebrate, or at Recellebrate on Instagram, TikTok, Facebook, LinkedIn, all those have a Recellebrate. I think we're the only people using that word, that spelling. So it's hard not to find us. We like to meet new people. Reach out anytime.
Awesome. Well, thank you so much for sharing this with us.
Thank you.